Let us now continue with the source points, this time featuring Li4. Li4 is located on the radial aspect of the hand between the first and second metacarpal bones, closer to the second metacarpal bone and approximately at its midpoint. How to find? When pressing the thumb and index finger together, the adductor pollicis and the interosseous dorsalis muscles will form a bulge. Needle Li4 at the highest point of the bulge and push it further towards the inferior aspect of the second metacarpal bone. Or spread the thumb and forefinger and place the distal phalanx of the thumb of the other hand on the webbed border. When flexing the thumb, its tip will point to Li4, or insertion on the angle bisector between the first and second metacarpal bones, needling in the direction of the midpoint of the second metacarpal bone. Needling 0.5 to 1 soon vertically or slightly obliquely towards the palmar aspect of the hand. Caution, reducing needle techniques are contraindicated during pregnancy. Exception to induced labor. Actions or indications. Li4 releases the exterior. So this is actually the main point for releasing the exterior. Regulates face and head, regulates defensive qi or wei qi and sweating, opens the channel and luo connecting vessels, alleviates pain, promotes labor. Special features, Yuan-Source point, Kawu command point for the head and mouth, Madanyang, heavenly star point, entry point according to some authors. The most important analgesic point for the whole body. The most important single distal point for disorders of the face and sensory organs. It is the most commonly used point in clinical practice. The combined bilateral needling of Li4 and liver 3, which is between the second and third metatarsal bones, is known as the four gates. They strongly regulate the qi and blood, stop pain, and relieve spasms. Li4 is the main point to expel wind heat and to release the exterior. Li4 also has a strong direct sphere of influence on the face, so that in exterior invasions, it is used to relieve nasal congestion, sneezing, burning eyes. Li4 regulates sweating and defensive qi in the space between skin and muscles, so that it can be used both to stop and to promote sweating in exterior invasions of wind. To promote sweating, Li4 is tonified and kidney 7 drained. Vice versa, to stop sweating. Li4 also stimulates the diffusing of lung qi, which explains its strong action in releasing the exterior and expelling exterior wind, so that it would be used for nasal congestion, sneezing, cough, stiff neck, aversion to cold, floating pulse. That is the beginning stages of a common cold, influenza, or many other exterior diseases. As Li4 stimulates the diffusing of lung qi, it makes it useful to relieve the symptoms of allergic rhinitis. Li4 has a powerful calming and antispasmodic action, so that it can be used in many painful conditions, both in the channels and in the organs, and especially the stomach, intestines, and uterus. It is also widely used as a distal point in painful obstruction syndrome of the arm or shoulder, since it removes obstructions from the channel. Since Li4 has a strong direct influence on the face and eyes, ears, nose, and mouth, it is often used as a distal point when treating problems of the face, including mouth, nose, ears, and eyes, such as allergic rhinitis, conjunctivitis, mouth ulcers, styes, sinusitis, epistaxis, toothache, trigeminal neuralgia, facial paralysis, and frontal headaches. There is a saying in Chinese medicine, the face and mouth are reached by Li4. Li4 is an important distal point for facial problems, such as deviation of eye and mouth following wind stroke, peripheral facial paralysis, and trigeminal neuralgia. It is sometimes combined with liver 3, and the combination is called four gates, to expel interior or exterior wind from the head and to stop pain. Although the combination of the four gates is widely used in the West to calm the mind, Chinese books actually do not mention this action. Li4 influences the mind and can be used to soothe the mind, and Ole anxiety, particularly if combined with liver 3 and with DO24 and GB13. Although it is not often used in this way, Li4 can also be used as a tonifying point rather than in its more common use as a draining one. Combined with other points, Li4 can tonify qi and consolidate the exterior or strengthen the defensive qi. It would be combined with stomach 36 and REN 6. This treatment could be used for chronic allergic rhinitis owing to lung qi deficiency and weakness of the exterior energetic layers, that is the defensive qi, which make the person prone to chronic attacks of wind. This treatment would only be suitable in between attacks to strengthen qi and the exterior in order to reinforce the defensive qi to repel wind. Li4 can harmonize the ascending of yang and descending of yin. This means that it can be used to subdue ascending rebellious qi, such as ascending stomach qi, lung qi, or liver qi, or to raise qi when it is sinking, such as spleen qi sinking. Thus, in the former case, it can be used to subdue stomach qi in epigastric pain, liver yang rising in migraine, especially combined with liver 3, or lung qi in asthma. In the latter case, it could be used to raise the spleen qi, especially in combination with REN 6. However, this last use is not common. Li4 is an empirical point to promote delivery during labor, hence its contraindication in pregnancy. To summarize, Li4 expels exterior wind, so it's very effective for colds, upper respiratory infections, and influenza beginning stages. Regulates sweating, benefits eyes, ears, nose, and mouth. Distal point for all problems of the face. Combined with liver 3, the 4 gates, to expel exterior wind, extinguish interior wind, and calm the mind. Regulates ascending or descending of qi, hence subdues rebellious qi in the head. Good for allergic rhinitis, empirical point to promote labor, calms the mind, forbidden in pregnancy. Thank you very much for your attention.